Hey guys, Dr. Charles Hogan from Memphis Spine and Sport here, coming at you real quick to talk about sciatica, okay? What it is, what you need to do about it, okay? So first of all, sciatica is nerve pain that goes down the leg, okay? There's a bunch of nerves in the leg that can be painful and pinch sometimes, but true sciatica usually comes down the back of the thigh, okay? And the sciatic nerve is actually made up of a bundle of nerves that comes from the low back, passes through the hip and buttock, and goes down the thigh. So when that nerve is pinched, super painful, okay? But what are you supposed to do about it, right? So first of all, let's talk about what you should not do, okay? And what the medical and orthopedic research shows is that patients with this condition should not be getting drugs like gabapentin and muscle relaxers, okay? And instead should be getting manual therapy, okay? So drugs and surgery for this condition are not particularly safe, they're not particularly effective, and that's just what's supported by the medical research, okay? So instead, chiropractic is the answer, okay? What we've got to do is go in there and get the pressure off the nerve, okay? But first we have to do a very thorough assessment to determine if that nerve is being pinched in the low back or if it's being pinched in the hip, okay? Or sometimes both. And then we'll go in there and treat the pain in the primary area, especially when it's in the hip like that. The dry needling works amazing for it to knock down the pain, or sometimes we use other therapies to get the pain down. And then the most important thing we have to go in there and do is correct the alignment, okay? That gets the pressure off the nerve, gives your body that chance to heal itself naturally. That's what's gonna get you your health and your function back, okay? So we'll go in there and get the pain down, correct the alignment, and then of course, lastly, we have to go in there and strengthen up the weak areas, whether it's in the low back or the hip, or even sometimes down in the leg and foot. But if we can do all those together, that's what will get you functioning normally. Scooting around throughout your day, bending, lifting, getting a good night's sleep, doing things you need to be able to do naturally without the drugs or surgery. So if you have sciatica, okay, get chiropractic care. It's gonna be your best bet.